Assalamu alaikum. Today we will start our discussion of dorsum of the hand. Skin on the dorsum of the hand is thin, hairy and freely mobile on the underlying tendons and the bones. And the nerve supply to this skin is coming from two nerves. One is radial nerve, the other is ulnar nerve. Superficial branch of the radial nerve. This is a branch of the radial nerve runs around the radius deep to the muscle brachioradialis and descends over the extensor retinaculum. It is responsible for supplying the skin on the lateral two-thirds of the dorsum of the hand and the skin over the lateral 3.5 fingers. Posterior cutaneous branch of ulnar nerve twins around the ulna deep to the flexor carpi ulnaris tendon and descends over the extensor retinaculum, supplies the skin over the medial third over the dorsum of the hand and the medial 1.5 fingers of the hand. Regarding the veins in the dorsum of the hand, these are arranged in a special arrangement called dorsal venous arch, which lies in the subcutaneous tissue proximal to the metacarpophalangeal joints, and it drains on the lateral side to cephalic vein and on the medial side to the basalic vein. Greater part of blood from the hand drains into this arch. What about the insertion of the long extensor tendon into the dorsum of the hand? The four tendons of the extensor digitorum muscle emerge from under extensor retinaculum and fans out over the dorsum of the hand. The tendons, they are embedded in the deep fascia, and they together they will form the roof of subfacial space. Strong oblique fibrous band connect the tendons to the fingers, to the little finger, ring finger and middle fingers. Tendon to the index finger is joined by the tendon of the extensor indicis. Also the tendon of the little finger joined by the tendon of extensor digiti minimi. On the posterior surface of each finger, the extensor tendon joins the facial expansion called extensor expansion. And this expansion will split into three parts. Central part inserted to the base of the middle phalanx. Lateral two parts, they are inserted to the base of the distal phalanx. Dorsal extensor expansion also receive the tendon of the insertion of the interosseous muscle and lumbricals. Artery in the dorsum of the hand. This artery winds around the lateral margin of the wrist joint beneath the tendon of the abductor pollicis longus and extensor pollicis brevis, and it lies on the lateral margin of the wrist joint, the lateral ligament of the joint. On reaching the dorsum of the hand, the artery descends beneath the tendon of the extensor pollicis longus muscle to reach the interval between the two heads of the first dorsal interosseous muscle. And here the artery will move from the dorsum of the hand to pass and enter the palm of the hand. An important landmark in the dorsum of the hand is anatomic snuff box. This is a skin depression, lies distal to the styloid process of the radius and is bounded medially by the tendon of the extensor pollicis longus muscle, laterally by the tendon of the abductor pollicis longus and extensor pollicis brevis muscle. In its floor, we can palpate styloid process of the radius and also the base of the first metacarpal bone of the thumb. Between these bones, beneath the floor, lies scaphoid and trapezium. And also the radial artery can be palpated within the anatomical snuff box, as this artery winds around the lateral margin of the wrist joint to reach the dorsum of the hand. Last topic in our series in the upper limb is the clinical notes, which means that the diseases that can be explained by anatomical explanations. One of these diseases, what is called Erb's-Duchenne palsy. Erb's-Duchenne refer to the name of the scientist that described this disease. Palsy means that a group of muscle have been lost their function, and this disease resulted from upper trunk lesion or disease or injury of the brachial plexus. And this figure, you can see this disease in the upper limb, where it's called Erb's-Duchenne palsy due to disease or damage to the upper trunk of brachial plexus. Another name is called waiter tip. Tip means hand. It refers to the position of the hand, which is rotated like that. And second disease or disorder is called Klumpy's palsy. Klumpy's, the name of the scientist, described this abnormality. And this disease resulted from injury or lesion of the lower trunk of brachial plexus. A third disease is the wristy drop, which resulted from injury to the radial nerve. You can see on abduction of the upper limb, the hand will hangs down, and this is explainable because injury to the radial nerve results in paralysis or loss of function of the muscle of the posterior compartment of the forearm, which are extensor for the hand, so that the flexor compartment or flexor muscle will flex the hand like that. Another entity called median nerve injury, ape-like hand. And this is ape-like hand due to the median nerve injury. On flexion of the fingers, medial fingers supplied by ulnar nerve are intact and flexed, whereas the lateral fingers, which are supplied by the median nerve, they are not flexed. Finally is ulnar nerve injury, which is called claw hand. Claw hand, which are characteristic for the ulnar nerve injury. By this, we are completing our series of lecture about the anatomy of the upper limb. And at the end of this series, I would like to thank you deeply for your listening for this group of lecture. Thank you very much.